If you're suffering with sciatica, it's very important that you know what the 5 severe sciatica signs are, because most of these signs mean you need to get some extra help from someone who can tell you what's going on. Hi everybody, my name is Will Harlow and I'm the Over-Fifties and Sciatica Specialist Physio here at HT Physio in Farnham. And today I'm going to be revealing the 5 severe sciatica signs which mean you need to go and get checked out because it could indicate something seriously wrong. Now, before we dive into the content of the video, if you haven't already, please hit like on the video and subscribe to the channel. And if you've enjoyed this video, please share it with someone else who would enjoy it, because then you'll be the first to hear about our new videos and you can help someone else who's in need. Now that that's been said, let's talk about the 5 severe sciatica signs. So before we talk about those signs, we need to define what sciatica actually is. Now, sciatica is just a word that describes a symptom, which is nerve pain in the leg. So the typical sciatica presents as sharp shooting nerve pain that runs all the way down the back of the leg. But that's just one type of sciatica. You can have sciatica that goes down the side of the leg. You can have sciatica that goes down the front of the leg. So basically the term just means nerve pain somewhere in the leg. And sciatica is just a symptom. It is not a condition in and of itself, but there are 5, 6, 7 different conditions that can cause sciatica. Now, most of these conditions are very treatable. Conditions such as bulges to the discs or herniated discs or facet joint arthritis or piriformis syndrome, just to name a few. These can all cause sciatica, and thankfully most of them are treatable. But when I'm assessing someone with sciatica, I look for 5 severe signs which mean that maybe something more sinister is going on, or the injury itself is very severe and we might need to get some help from a consultant or a different type of specialist. So I'm going to go through what the 5 severe signs are. If you have any one of these, my advice to you is to get some medical help or to get some advice. You might need an MRI scan to confirm the diagnosis. You might just need to be looked at by a specialist. And in severe cases, you might need surgery. But if you have these signs or symptoms, I don't want you to worry straight away. They can come about with the normal conditions that cause sciatica as well, but they just tend to be more common in people with severe problems. So let's talk about what the 5 signs are. So the first sign that we look for, the first severe sign with sciatica, is complete numbness somewhere in the leg or the foot. Now, when you've got sciatica, basically what's happening is one of the nerves in the spine or in the hip is being pressed on either by a joint or a muscle or a disc or something else. And to cause the pain, you actually don't need much pressure on the nerve. It can just be a slight touching of the nerve. That's enough to set the pain off. And once you've touched the nerve a few times, you get a cloud of inflammation around the nerve, and that causes the nerve to be irritated, which means the pain carries on. So sciatica is not very pleasant, but sciatica can progress to numbness if the nerve is more severely compressed. So let's imagine you've got a disc bulge, which is a very common injury of the spine, and it involves these discs that sit between the vertebrae here. And the fluid center of the disc has pushed towards the back of the disc and it's touching a nerve. So if that disc is just touching the nerve, what you'll get is sciatica. But if that disc is pressing on the nerve and it's squashing it, what you'll get is the fact that the nerve can't transmit signals anymore down into the leg, which means you get numbness. So numbness indicates a more severe compression of a nerve. And it doesn't necessarily have to be a disc that's compressing the nerve. It could be a thickened facet joint, which has got thickened through arthritis. It could be that the nerve is trapped by something like a spondylolisthesis, which is where the vertebrae slip on top of each other. It could be that the nerve is very severely trapped in the buttock. But whatever it is, if it's causing numbness, we know that the entrapment is quite severe. Now, thankfully, usually sensation comes back as the problem improves, but it can take a long time. And if you've had numbness in a particular, what we call dermatome, which is a pattern of skin down the leg for a long, long time, it can take a long time, maybe and never, for it to get better. And if you've had numbness following a particular course down the leg for a very long time, sometimes it doesn't actually get better at all. So if you have numbness, we always recommend to get checked out as quickly as you can. Now, the second severe sciatica sign is sciatica in both legs. So for most people who have sciatica, if they have a problem in their back, the problem will be either on the right or the left. And if it's the right-sided nerves that are being affected, you'll get pain down the right leg. And if it's the left-sided, you'll get pain down the left leg. However, if you get a problem, typically a disc bulge, which is central, so it comes directly out the back rather than to the right or to the left, it can pinch the cauda equina, okay, which is the bundle of nerves that run by the spinal cord down here, or it can affect both nerve roots as they both come out the sides of the spine, and that can cause pain down both legs. Now, typically anyone who has pain going down both legs, we think of that as a central problem. So it's either affecting the central spinal cord or both nerve roots, and those problems tend to be more severe. Now, sciatica down both legs, it can happen from a disc bulge, but we'd always be very worried about cauda equina syndrome with anyone who's got sciatica in both legs. We'll speak about that in a minute. And sometimes sciatica in both legs can indicate something else centrally. Sometimes I've had patients who've come in with strange sciatica in both legs. We've sent them for an investigation and there's been something nasty like a tumor in the spine. And I'm not saying this happens very often, but it's possible. Okay, so if it's something pressing on the spinal cord or on the cauda equina, it can cause pain in both legs. So if you have sciatica pain in both legs, it's definitely worth getting checked out because it's usually a little bit more severe than you just have it in one side. Now, the third severe sciatica sign is any of the symptoms of cauda equina syndrome. Now, cauda equina syndrome is thankfully a rare condition. It only affects about 1 to 2 in every 100,000 people, but it's characterized by something in the spine squashing the cauda equina, which is like a bundle of nerves that runs just down underneath the spinal cord and spreads off to go down the legs. So the cauda equina, it's housed by the vertebra, but if we bend the vertebra forward, if you can see the yellow area in between here, in between these vertebrae, that is the cauda equina. So most people think of it as part of the spinal cord, but if you want to speak technically, it's got its own name, which is the cauda equina. And if you've got a disc bulge that comes directly out the back of the spine, then that can squash the cauda equina. So why is that more severe than if you're getting one of the nerves squashed? Well, the cauda equina has several nerves in it that run down into your groin and supply your sensation around your genitals. They also supply the ability to control your bladder and your bowel. And if those nerves are squashed or impinged, you can lose the ability to control your bladder or your bowel, and that can be permanent, okay? So even though cauda equina syndrome is rare, it's very severe when it happens and it needs urgent medical attention. So if someone has cauda equina syndrome, there are a range of symptoms that can affect them. The most common are difficulty controlling their bladder or their bowel. So that might be that they're incontinent. They also might not be able to initiate the flow of urine. So they might get in front of the toilet and they just can't go. The same might be true of the bowel as well. They also might find that they've got numbness in the saddle region. So when they're sat on the chair and when they're wiping their bottom, they can't feel it at all. There's just no sensation there. They might also notice sexual dysfunction. So in men, it might be an inability to gain or sustain an erection. In women, it might be a numbness there, which prevents them from feeling aroused. And typically people with cauda equina syndrome will also have pain in both legs, so sciatica in both legs, and most of them have back pain as well. Now, the symptoms I've listed there are not exhaustive, so if you have funny symptoms that you're not really sure about, it's always worth getting checked out. But if you have any of the cauda equina syndrome symptoms, I would encourage you to go to your emergency room straight away because it represents a medical emergency and someone should take you very seriously when you get there and give you the help you need. So that's the third thing we look for severe sciatica signs. Now, the fourth severe sciatica sign we look for is persistent pain at night time or rapid weight loss. Now, there are things that happen medically that can cause sciatica, which can appear like disc bulges or facet joint problems. Now, the big one that scares us the most is probably cancer. So tumours can form in the spine and they can press on the spinal cord or press on the nerves and give sciatica, which might look quite innocent at first, but in reality there's a more severe cause. So typically people who have cancer or tumours causing their sciatica, they have a slightly different set of symptoms, and one of the common features we see is their pain tends to get worse when they lie down. Now, the reason this happens is because when they're lying on their back, if they've got a tumour there, it's pushing the tumour further into the nerve. So it's very mechanical how it works. And if you just have a disc bulge, or if you have facet joint arthritis, or if you have piriformis syndrome, usually lying down makes it feel better, not worse. So that's one big sign. And for this reason, people who have tumours in their spine, they often suffer from really bad night pain. Now, sciatica does give pain at night, even the most normal types. So disc problems do cause night pain. But usually people with disc bulges will still be able to get at least some sleep. When you have something like a tumour or cancer causing your sciatica, the sleep tends to be a lot harder to find and the pain tends to be worse at night than it is in the day. So we call this unremitting night pain. So if you have very, very severe night pain, it's worse at night than it is in the day. That is what we call a red flag symptom for something more severe, so it needs to be checked out. Now, the other sign that someone might be suffering with cancer or another illness that's causing their sciatica is they tend to have a hard time keeping weight on. So they're losing weight in an unexplained way. So if you've noticed that you've lost a significant amount of weight over the last 4 to 6 weeks and you've had sciatica at the same kind of time, that is another red flag and it should be checked out. Now, again, we just need to caveat this by saying that most people who are losing weight, it's not because they have cancer or anything more severe, but it's just something that needs to be on our radar. So if someone's saying, I've got this really bad sciatica, it hurts worse at night, and I've also lost a few pounds over the last week or so, and I haven't even put myself on a diet, my little alarm bells would be going off, and I'd be asking that person to get checked out. So watch out for unremitting night pain that gets worse when you lie down, and unexplained weight loss. Now, the fifth sign of severe sciatica that we look for is extreme loss of strength in one or both legs. So going back to the first thing we spoke about when we spoke about the numbness that happens in the leg when you've got something pressing on a nerve, if that nerve compression gets even worse and it really squashes the nerve, what happens is that the muscle fibers that are supplied by the nerve, they don't get any supply anymore. So there's no signals going from the spine to the muscle because they just can't get through. And that means that the muscle has got no stimulus to make it contract. What that means is the muscle that's affected becomes incredibly weak. So often we see this in something called a foot drop. So when someone's walking, they can't control their ankle, so their foot slaps on the floor. These people often find themselves tripping over all the time. So if you've got sciatica and you notice you're catching your foot and tripping, that is a severe sign. We also find that these people, they can't go up on tiptoes if it's one of the L5 or S1 nerves that's affected. They also might not be able to move their toes because the toe muscles are affected. They also might not be able to weight bear very well on their knee because their quadricep muscles above the knee are not taking their weight anymore. But any way that your legs are affected, if you have any kind of weakness, it's always worth getting it checked out. And the reason for this is if the weakness is very severe, often it needs a surgical intervention to take away whatever's compressing that nerve to allow the signals to get through again, and then your muscle will recover. For people who have very bad weakness in their legs and they don't do anything about it and it stays there for a long time, unfortunately, that weakness can be permanent. Not always, but it can be. So I'd always recommend someone gets checked out if they have weakness in one of the muscles in their legs as well. So that is all I have for you today. Those are the 5 signs of severe sciatica. I'm just going to recap them for you now. The first one is numbness in the skin, in the legs or the feet. The second one is pain in both legs. The third one is any of the symptoms of cauda equina syndrome. The fourth one is unremitting night pain or unexplained weight loss. And the fifth one is loss of strength in any of the major muscle groups of the legs. Anyway, that's all I've got for you today. If you found this video useful, please leave me a comment below and share it with someone who you think would find it interesting. And if you want to get more from me, you can pick up a copy of my book. It's called Thriving Beyond 50, and you can find it on Amazon using the link below this video. Anyway, that's all I've got today. Thank you very much for watching, and I look forward to speaking to you on the next one.